What is the iceberg phenomenon of disease?
Detected or diagnosed disease is the tip of the iceberg, and the submerged portion comprises disease not medically attended but not accurately diagnosed, and diagnosed but not reported.
Define screening test.
The search for unrecognized disease or defect by means of rapidly applied tests, examinations or other procedures in apparently healthy individuals.
What are the differences between screening test, ST, and diagnostic test, DT?
Initiative from investigators in case of screening test, ST, while in diagnostic test, DT, initiative is from patient. ST applies to groups, DT to individual patient. Less accurate, more accurate. Less expensive, more expensive. Not a basis for treatment, based on one criterion or cutoff point, based on clinical features.
Define validity.
To what extent the test accurately measures which it purports to measure.
Define sensitivity and specificity.
Sensitivity, the ability of a test to identify correctly all those who have the disease, that is, true positive. Specificity, the ability of a test to identify correctly those who do not have the disease, that is, true negatives.
Define positive predictive and negative predictive value.
Positive predictive value, probability that a patient with the positive test result has, in fact, the disease in question. Negative predictive value, probability that a patient with a negative test result has, in fact, not have the disease in question.
Define false positive and false negative value.
False positive, patients who do not have the disease are told that they have the disease. False negatives, patients who actually have the disease are told that they do not have the disease.
Define lead time and yield.
Lead time, the advantage gained by screening, i.e., the period between diagnosis by early detection and diagnosis by usual time. Yield, the amount of previously unrecognized disease that is diagnosed as a result of the screening effort.